1. Which electrolyte imbalance causes muscle cramps and weakness? A. Hyperkalemia. B. Hyperkalemia. C. Hyponatremia. D. Hyponatremia. Answer. B. Hyperkalemia. Explanation. Low potassium, hyperkalemia, often leads to muscle cramps and weakness. 2. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD. Which oxygen delivery method is preferred? A. Nasal cannula. B. Non-rebreather mask. C. Simple face mask. D. Venturi mask. Answer. D. Venturi mask. Explanation. Venturi masks deliver precise oxygen concentrations, ideal for COPD patients. 3. The nurse should assess which vital sign first in a client with suspected hypovolemic shock. A. Temperature. B. Blood pressure. C. Pulse rate. D. Respiratory rate. Answer. C. Pulse rate. Explanation. Tachycardia, increased pulse rate, is an early indicator of hypovolemic shock. 4. Which action is the nurse's priority when a patient is having a seizure? A. Insert a tongue blade. B. Restrain the patient. C. Protect the patient from injury. D. Provide oxygen after the seizure. Answer. C. Protect the patient from injury. Explanation. The primary goal during a seizure is to keep the patient safe. 5. Which medication is used to reverse opioid overdose? A. Naloxone. B. Diazepam. C. Flumazenil. D. Atropine. Answer. A. Naloxone. Explanation. Naloxone is the antidote for opioid overdose because it rapidly reverses the effects of opioids on the brain and respiratory system. 6. What is the appropriate action if a patient refuses medication? A. Force the patient to take it. B. Document the refusal and inform the healthcare provider. C. Ignore the refusal. D. Double the next dose. Answer. B. Document the refusal and inform the healthcare provider. Explanation. Patient autonomy must be respected. Refusal should be documented and reported. 7. What is the first step in performing CPR on an adult? A. Check for breathing. B. Start chest compressions. C. Open the airway. D. Call for help. Answer. D. Call for help. Explanation. Always ensure emergency help is activated before starting CPR. 8. What is the common side effect of opioid analgesics? A. Hypertension. B. Constipation. C. Diarrhea. D. Tachycardia. Answer. B. Constipation. Explanation. Opioids frequently cause constipation. 9. What does the Glasgow Coma Scale, GCS, assess? A. Cardiac function. B. Muscle strength. C. Respiratory status. D. Level of consciousness. Answer. D. Level of consciousness. Explanation. GCS evaluates eye, verbal, and motor responses to assess consciousness. 10. Which lab value indicates kidney function? A. Hemoglobin. B. Creatinine. C. Albumin. D. Glucose. Answer. B. Creatinine. Explanation. Creatinine is a key indicator of renal function.